Unity Health is a leading healthcare provider in a 7-county area with over 438 licensed beds, with a medical staff of 150 physicians from a variety of medical specialties.
The emergency medicine residency program here is 3 years. We have 18 residents, 6 per class. We have 29 total rooms in our ED with 6 resuscitation rooms.
We're a unique program in that we have 13 ABEM certified emergency medicine physicians, which is actually the second largest group in the state.
Our emergency medicine residency program here is a community-based program. So what does that mean? I think that means that we don't work on the umbrella of an academic center, even though we do promote academics here.
It's designed to train residents to practice community-based emergency medicine.
We get to do all of our own procedures here. We get to run all of our resuscitations. We have a lot of autonomy in our department.
Residents come here, they don't have to compete against other specialty programs for patients or procedures.
Being autonomous here really is probably the key. You get to wear all the hats for all the subspecialties, from OB-GYN to anesthesia to surgery to pediatrics, geriatrics. You have to do a little bit of it all, and you have to be a decision maker for all of those.
For me to teach SimLab, it's actually a lot of fun. We have a lot of fun with it. It is a great learning tool because it puts you in real life situations without having a real life patient. You come in, we have a patient, we have a clinical scenario. I give you the clinical scenario and then we go with it. And it's really kind of off the cuff. We spontaneous. If you make one decision, we may change the scenario to make something else happen. So it really kind of makes you think on your feet.
I do most of the education for the point of care ultrasound, which is a pretty important aspect of emergency medicine these days and going forward. We have software to save their images, and so we can do quality assurance, and I can give them updates and pointers on what they need to improve on.
The faculty are excellent teachers, and we have very good clinicians that understand what it's like to practice bread and butter emergency medicine.
You always have your attending that's there to support you, or an upper level resident.
The relationship between residents and faculty is outstanding. The emergency medicine faculty love having the residents in the ED. There's no doubt about it.
You spend a lot of time with the residents during shifts, 12-hour shifts, working with somebody in the next chair. You get to know them pretty well. I think that's one of the beauties of emergency medicine, not just with the residents, but with the nurses and the staff as well. You get to know people.
We meshed pretty easily just from day one. Everybody's really friendly, really accepting. There's really a family type atmosphere amongst the residents and the faculty here.
Sometimes whenever I'm at work, I feel like I'm just hanging out with my friends, both with the residents and the attendings. It's a really cool, unique experience to be able to be hanging out with your friends, both in and out of work, and then also with those same people be able to perform life-saving procedures and resuscitations. It's unlike anything else that I could ever describe.
The experience that you're going to get with Unity Health is basically going to be hands-on. You're going to be autonomous. The staff here is exceptional. I think we care about you being here, and we care that you learn. We spend a 12-hour shift. We're going to sit side by side, and we're going to talk about everything that comes in the door. We're going to see every patient that comes through the door. And then we're also going to talk about everything else, from what's going on in your life, what's going on in my life, what's going on in sports. We're going to cover it all. So I think it's more of a one-on-one interaction.
We just have a tight-knit group. I think that everyone involved in this residency program wants you to succeed.